So just talking a little bit about clinical academic careers, trying to kind of make it a bit more relevant to colleagues who work in research delivery. We've got some really successful people working in a clinical academic capacity that come from a research delivery background, usually great skills in relation to conducting research, obviously, with the work that they do, but then also that can move quite nicely into developing your own research career and developing your own clinical questions to ask. So I am going to talk a small bit, but only a very small bit, about the importance of nursing research in healthcare. I'm not sure that I'll need to convince people here today of the importance of research per se, but just talking a little bit more broadly about nursing research, or research done by nurses, which we are calling nursing research. There's lots of names, but it is generally just research. I'm not sure why we call it nursing research. I think that's because it's done by nurses in relation to sometimes nursing, but nurses do lots of types of research. So we should just say research. Just talk a little bit more really about the clinical academic career pathways, which are growing all the time, both from a national, a regional and a very local perspective, and just making people aware of opportunities that are available to them in relation to training and development. So clinical academic careers, really, it's when you're working in clinical practice in some capacity and doing research concurrently. And what's interesting about healthcare professional research, and I'll refer to healthcare professional research, what I mean is research that's not done by doctors and dentists, but absolutely everybody else in the landscape. So we are the biggest group. We often referred to as non-medical, but I think we need to push the boundaries and stop saying that and start talking about healthcare professionals more broadly. And there's quite a lot of, I suppose, there's a lot of examples of how healthcare professionals in general are doing clinical practice and research, and there is no real sort of chosen definition. And you will hear some people saying, well, you should be doing 50% working clinically, either on the wards or in whatever clinical role you're doing, sometimes advanced practice, as well as 50% research. But unfortunately, at the moment, we haven't got a defined pathway. So it's quite difficult to define what people are doing, because there's people needed to do leadership in this area, because if we don't have leaders, then we aren't going to have any kind of move forward in this work. Leadership takes a lot of time. It's very difficult sometimes to be doing your own research portfolio while you're trying to lead on the agenda, but many of us are trying indeed to do that and squeezing clinical practice in. One of the things I am quite clear about it not being is it's not killing yourself to do 2 full-time jobs in half the time. And I think it's really important that as we forge our way forward, we start to really challenge some of that success around clinical academic careers. So as I said, really, research leadership, clinical leadership, pursuit of innovation, scholarship, excellence, but really it's about producing the evidence base, which, as it happens in nursing, midwifery, and for many other healthcare professionals, is really sadly lacking. We do a lot of things because we've always done them, and our evidence base isn't as strong in many aspects as we would really like it to be. That said, we've also got some great research that's been previously done and is currently being done. So there is a lot of activity. But our biggest challenge really as a professional groups at the moment, healthcare professionals, is that we need to build capacity and capability in others. And make sure that people have got the right skills to do what they want to do. And that's the most important thing. Because actually research, as you will know, is a completely different language when you're grant writing or whether or not you're delivering research. It's a complex landscape. So we need to make sure that we're building ability for capacity and capability to undertake research for those who are working as healthcare professionals. And then also we need to do that because we need to be able to challenge practice, and we need to build the evidence base around that and ensure that we've got good health outcomes. for populations. So it is really about clinically relevant and clinically driven research. So questions that need answering that allow us to make sure that the outcomes are the best they can be. You will all know that research is the NHS's core business, and those organisations that are research active often do demonstrate improved patient outcomes. It's a shame in any given organisation when that's only on behalf of medical colleagues. We do need to ensure that healthcare professionals more broadly, nurses, midwives, AHPs, scientists, and the other 23 professions that come alongside that are also well represented in research and are indeed going after some of the research funding to ensure that they're doing research in their area. And we know that research is very important to patients and the public, and it's equally as important to be researching in lots of different professional groups, not only around workforce development, but also around clinical care. So many of you here will sort of have heard this debate, research nurses versus nurse researcher. Regardless of where you work, I think this is more of a continuum. It's not a dichotomy. You've not got one or the other. I think many people who are acting as research nurses, research midwives, research allied health professionals are often research active. We have lots of people within the trust that are working in those roles that are undertaking PI on studies. And who also are doing a great job in running those studies. And then you've also got the nurse researcher. And as I said to you before, what's interesting, I think, is that we call it nursing research, and there's always a big debate, usually on Twitter, about what nursing research is. Is it research done by nurses? Is it research that is nursing focused, that focuses on what nurses are doing or the way nurses are delivering care? And I have to be totally honest with you, it doesn't matter so much to me. I think as long as the person that's wanting to do the research and be involved in whatever way have got the skills and capacity to do that. But specifically around clinical academic careers, it's around designing and delivering programs of research which are actually adapting to the changing demands of a healthcare system. So whether you're doing that very patient focused or whether you're doing that workforce focused, it really is about the design and the delivery of that research as well. Huge national agenda around this, been going around about 10 years now, when there was the first report, I think back in 2008, where it was acknowledged that there needed to be some infrastructure and some funding support for healthcare professionals other than doctors and dentists to conduct and be responsible for research. And since then, there's been various national documents that have come out, the latest one being from the Council of Deans around students and research and learning about research, which also includes clinical academic careers, and many different documents in between. There's just a snapshot of a few there. So again, this is just a kind of Wordle thing that we did with a group of ward sisters and charge nurses and matrons on one of the time out days. And I think this is what we ask the question, you know, what is it a clinical academic can bring to an environment? And you'll see there lots of opportunity, drive, partnerships, strategic planning, innovation, transformation within clinical practice. Lots of reasons really why we should be encouraging this kind of working as we go forward. I think one of the things that is a challenge for the professions at the moment is that we don't have established roles for clinical academic healthcare professionals outside of medicine and dentistry. They do have a very clear pathway to success around clinical academic activity with established job roles, etc., which is obviously very similar in whatever organisation you work. But you do have to be careful what you wish for. Lots of people say that they want these career pathways and roles for the other professions, but Often our medical colleagues will say that they would like the opportunity to be more innovative, like we are across the rest of the professions at the moment, with the different types of job roles that are available, because these are all often being done very locally around the strengths of individuals. And you'll see that at NUH, that we do have individuals working in divisions, in nursing, in midwifery, and some allied health professionals and scientists who are doing joint clinical academic roles, either within the trust or joint with the university. And they all look incredibly different. But there's a lot of work going on nationally to look at what this can look like, where the funding for this might come from, and what some of the impact and benefit for that might be. So just a little bit about the opportunities that are available, and these opportunities are available for staff at NUH. There's lots of support in the institute and in the divisions, and across R&I, in order to help you access some of these opportunities. If you are interested, please do get in touch with myself. We've got Sarah Brand is also on the call, who knows a thing or two about this kind of stuff. So lots of people for you to talk to in lots of different specialties across the trust. So please do come along. So I'll just go through each of these in turn, just to sort of talk a little bit more broadly about what might be on offer. So nationally, the NIHR, so the National Institute for Health Research, you'll all be familiar with them. They have the NIHR Academy, who is responsible for the development and training and career development and clinical academic training for those who are going on this kind of NIHR funded pathway. I'm going to talk quite a bit about the NIHR and the pathway that they have to fellowships and support to gain some of this training. They are kind of known as the gold standard. And I think in reality, what that means is they do offer fully funded fellowships, which means that they will support your wages in order for backfill within your clinical areas while you go off and do your training. Highly prestigious, but also highly competitive. But what we do know and what we've learned at NUH is for those people who are applying for fellowship funding to develop their own clinical academic training, if you can put together a competitive NIHR application, you can then usually use that as the blueprint for all of the other opportunities that are available for funding. And they can come from lots and lots of different sources. So we've had nurses, midwives and AHPs throughout the trust who have been funded by charities, specialty charities, renal charities, midwifery charities, childbirth trust, lots of different charities that are supporting training for nursing and midwives. The RCN, we've got a couple of people at the moment in the trust who are funded to do their PhD via the RCN at the University of Sheffield. So there are lots of other opportunities nationally, but if I walk through some of the things that the NIHR Academy are doing, that's often a good way to sort of understand what's around. So obviously it's about attracting and retaining talent and developing skills. So this rather complicated looking document sort of maps out, it's the latest version of what the NIHR have to offer. And you'll see there that they have fellowships for all. They also have health and social care professionals. So these are the health and social care professionals that I talked about, which are traditionally called non-medics and are not doctors and dentists, but are available for anyone who's working outside of those roles. There are some pilots going on at the moment for a local authority, people that are being funded. And then, of course, there is the doctor and dentist pathway, as well as the research training for all, which comes through the NIHR infrastructure, which you may be more familiar with around things like the ARCs, Clarks, which were Clarks, now ARCs, and the biomedical research centres, both of which we have locally in Nottingham, as well as some of the other training pathways. So I'm going to talk about the red section in the middle, which is Health Education England and NIHR funded integrated clinical academic programme. But any application for that programme can also be applied for the Fellowships for All programme. And they do that at several different levels. You'll see there, they do it at pre-master's level, which is this kind of pre-doctoral clinical academic fellowship, also called the PCAF for short. Does offer funding for master's level training in research. So that can be bespoke courses that you need in order to progress to a doctoral fellowship, or it can be a full master's, depending on what you need. I'll talk a little bit more about the PCAF in a second, because it's got two elements to it. Some of these can get quite complex. They also do a clinical doctoral fellowship, so that is to undertake PhD training. They have post-PhD, which are NIHR clinical lectureships, and we do have, I think, 3 of those in the trust at the moment, a midwife, a paediatric nurse, and a physiotherapist. And they also do a senior clinical lectureship, but we just need to progress our clinical lectureships before we get that far. So it's focusing there, as I said, on integrated NIHR clinical academic pathway. These applications are quite lengthy. They're quite big. They usually take around 6 months to a year to develop. And that's not necessarily just writing the application. That's about making sure that you have developed a kind of proposal for your research, that you have some ideas about where you want them, and depending on which part of the pathway you enter depends on how much work you will need to have done to refine your research question. So the PCAF doesn't ask for you to refine your research question at all. It just gets you to talk about a general area in which you want to research and how you might get training in order to progress to a doctoral fellowship. For a PhD, you have to be very clear about where you want your research and what your research question is and what your training is needed to get to that end point. And by the time you get up to the clinical lectureship, you've already got an ongoing program of research that they will be looking at funding. But they're often focusing on 3 things. They're focusing on the person, so that's the person that's applying, the place in which they're applying from and who's supporting them, and their project. And they will often put different emphasis on different areas of those of importance. I have known if they really like the application and the person who's applying, so the person manages to articulate that they are incredibly successful for where they are at their point in their career, they will often forgo and support them to get the right project in order to progress on the pathway. But generally, these things are incredibly competitive. You would have expected to have been in touch with academics and clinical academics, both locally and nationally, and sometimes internationally, if that's where the expertise in your research area lies, in order for you to progress. And we've developed a lot of expertise at NUH over the last 2 or 3 years in getting hold of some of these fellowships. So we know what goes into a successful application and how to support. And to be honest, if you aren't doing it and you haven't applied, then you definitely aren't going to get it. So if you are interested and it's something that you're interested in, then we absolutely will support you to do that. So the doctoral fellowship, the PCAFs that I was talking about, they can support aspiring clinical academics. They do offer funding in 2 distinct ways, the standard PCAF and the PCAF bridge. So you'll see there that they're both time-wise very different, but they will both offer salary costs for the time that you're undertaking the fellowship. But that's, you know, if you're asking for 4 days a week for 6 months, then they'll pay 4 days a week for 6 months, or 2 days a week for 12 months. They don't generally tend to pay more than you ask for. Again, very different funding streams. So the standard PCAF will allow you to apply for up to £5,000 worth of funding, whereas the PCAF bridge is quite considerably less. And the reason these 2 schemes really have been developed is because lots of people who were applying for the standard PCAF just needed that little bit of extra support with some master's level training modules to go on to do the PhD. So they've developed this PCAF bridge side of this programme because there was a recognition that not everybody needed that fully funded master's level training. They'll also support with conference fees, meetings and travel, and then also up to £1,000 for supervision and mentorship costs for the standard PCAF, and £500 supervision and mentorship costs for the PCAF bridge. But to be honest, if I'm supporting an application as a mentor, I will generally encourage people to plough the mentorship costs into further training for themselves, which I think is a good way to go. So the doctoral fellowships, these will be funded, fully funded, to undertake PhD level research and a professional development plan alongside that, as well as being expected to retain some kind of practice role. And they're often looking for the retain practice role to sort of build on your current knowledge. So how are you going to stretch yourself and develop your abilities in clinical practice? So that's something to think about. Successful candidates must be from an English NHS trust, other healthcare organisation, or a HEI, so that's a higher education institute, i.e. university. They must have a minimum of 1 year's clinical experience. That's often around preceptorship and ensuring that they that individuals have consolidated their learning, and they do have the support of excellent academic and clinical supervision. And as I said to you before, that they would expect you to kind of go slightly further afield from Nottingham to find the experts. Can be 3 years full-time. There are part-time options available. And as I say, it does fund that salary costs, or at least brings the money back into the trust for them to backfill your post for usually the 3 years or the 5 years part-time that you are not in the trust, as well as that professional development costing. And lots more things go into these applications. Again, we've developed a bit of an expertise of how to do that over the past few years. So I'd certainly recommend that if that's something that you're interested in pursuing, then certainly to get in. And again, the clinical lectureships, these are for postdoctoral. We now have 19 postdoctoral nurses and midwives in the trust. There's a gathering army of allied health professionals and scientists. So there are growing numbers of people who are postdoctoral and are in a position to apply for some of these more senior training awards. And again, if that's something that you're interested in, some great ways now to get on the pathway and get some support prior to the application to make sure your application can be as strong and as good as we can possibly get it in relation to you. So that's all very pleasant because it makes it seem very pathway orientated, lots to do, keep going linear, but in reality it's a little bit more different than that. It's usually people step onto the pathway, they step off the pathway and go back into clinical practice. And that's when the kind of challenge around clinical academic roles becomes a problem, because we now have got people who come out of doctoral training and because they find it difficult to get a job, we're often losing them out of the organisation. Something that we are trying to address, as I said, both locally and also working with colleagues nationally to see how we're going to solve some of the challenges that we have. So regionally, there's a number of initiatives regionally. So Health Education England, alongside the University of Lincoln and the University of Nottingham, offer internships. So these sort of slot into the different bits of those kind of pre-doctoral, doctoral and postdoctoral, and these kind of sit alongside and slot in between them to give you small pots of money to really help and support you to go on these programs to get you to the next level. They were formerly known as the bronze, silver and gold. Now internships, pre-doctoral, and you can do that at the University of Lincoln, which is formerly known as the bronze. The application deadline for these is actually today. They come out every year. Certainly will be around next year, and certainly are an opportunity for people to have a bit of a taster and learn a lot more about the pathway before going for some of the bigger fellowships. You can also join the East Midlands Clinical Academic Practitioner Network, which was established in 2017. Haven't met recently because of the pandemic, but are looking to revitalise that network and meet up with other like-minded individuals from across the East Midlands. And that's a growing network of around 250 to 300 people who are working in, interested in, supporting fellowships, working in universities, working in trusts, working in healthcare trusts and health and social care. So lots of opportunity to connect with people who are also interested in what you are interested in. Again, if you're wanting to apply for that to get you onto the pathway or are interested in at least having a conversation, please do come and chat to myself. I've got Helen Januszewski, Joe Cooper in the Trust, Joseph Manning in the Children's Hospital. We've got midwives, AHP colleagues, clinical scientists who are working in capacity and capability roles. So that means their job is to support others to gain the training that they need to go on this pathway. So locally, so you'll see there that this is a very old diagram now, but we talk about early career, mid-career and senior career researchers, and you'll see that the way the pathway is structured is to support people kind of through this pathway really. But one of the things that we recognised at NUH was that quite often for nurses and midwives, some of our AHP colleagues need that extra little bit of support before going on to some of these pathways and really wanted to learn more in-house. So we've developed quite a comprehensive programme of in-house support over the last few years that allows people to do some of that. And we've also introduced kind of research and innovation discussion into sort of almost every contact point that we have with people across the trust. And many of the programs that we run, you will often hear people talking about this as a possible career opportunity, which hasn't necessarily been as transparent as some of the other opportunities and development opportunities that nurses and midwives certainly generally have. So here in Nottingham, we've developed kind of mentorship and evidence in practice programs. We run that once a year. That's an opportunity for people to come out of clinical practice. It's about one day a month. And to work alongside colleagues to learn a little bit more about the research process, about innovation in practice, and develop a practice improvement project alongside that work. That is ongoing at the moment, usually starts earlier in the year. But we also now have the Nightingale Leadership Fellowship programs and some of the other early career fellowship programs, including the Chief Nurse Fellows, which is a great opportunity at divisional level to be involved. I think we really will be pushing when we have a new lead nurse in R&I to think about whether or not there are going to be any R&I fellows who also may have an opportunity to develop. I'll certainly be pushing that as Catherine starts in a few weeks. We developed the Step Into programme a few years ago. That's an opportunity to work with us over 6 months to develop a PCAF application or a master's application for other funding or a PhD application. That's a 3-hour workshop every month, and there are people on hand to support and help you to do that application. You don't necessarily have had to have been on any previous internships, although often it's an extra piece of support to get from an internship to the next part of the programme. And we've had people successfully gain PCAFs, clinical doctoral fellowships and PhD level funding from that course. So if that is something that you're interested in, we'll be looking to start that at the end of September, early October. We've also had postdoctoral programs running for the first time in the last year, slightly thwarted by the pandemic. Well, it hasn't been, but that was a small amount of funding that we've got to support some postdoctoral grant writing. We also have many of our nurses and midwives and AHPs who are on the clinical academic pathways with honorary appointments at local universities. We've got a few honorary professors in the trust, but we also have clinical professors in nursing in the trust. Professor Jane Code, who is children and young people, but we employ her as professor in nursing to support nurses and midwives across the trust. And we also have a specific professor in nursing in skin integrity in Christine Moffat, who has been employed by the Trust to really start to look at the infrastructure for managing skin integrity across the Trust. We have clinical lecturers in the Trust who are available to support with applications. And we also have opportunities with NUH Charity in order to also grow some of our clinical academic activity. There are lots of useful resources out there. We have websites, there's lots of different places you can go. The NIHR website is a really good resource of information. If you just Google clinical academic careers, and there's also some links there that we'll be able to share the presentation with you if you want, and you can